Morning, good afternoon, everyone. Welcome to this first webinar in a series on quality care for maternal health, organized by the Network for Improving Quality of Care for Maternal, Newborn and Child Health. I'm Benedict Walter from the Secretariat of the Network, and I would like to introduce our speakers today. We will have about 30 minutes of presentation. As you may have seen from the invitation, we should have had Zenebe Akale talking on behalf of the Federal Ministry of Health for Ethiopia, but he can unfortunately not make it today. He's sorry about that. So Hiwot Wupshet, the country director for the Maternity Foundation in Ethiopia, will make her presentation about the Safe Delivery app and how it has been used in the country. She will also present the slide for Mr. Akale on behalf of the Ministry of Health on how this app is really now, the use of the app is really part of the effort that the country is driving to improve quality of care more broadly. And then we will have my colleague Maurice Bukagu, who is a medical officer at the World Health Organization in Geneva. We'll talk a little bit about the current context for maternal health and continuing of providing quality service during the COVID-19 outbreak. In total, this will make about half an hour, and we are really keen to have another half hour with you to answer any question you may have for the speakers. You are all muted on entry, but we really want you to interact with the speakers. So please type your question in the bottom right of your screen in the chat box. You can see a message from me there. This is where you type your question during the presentation. And in the second half of the webinar, we'll be reading your questions out for the speakers to answer. We will be sending the presentations with the recording of this session and posting them on the Quality of Care Network website. We also send you a link directly to all of you who have registered, because we have your email addresses. So please, I'm now handing over to Hiwot Wupshet, the country director for the Maternity Foundation in Ethiopia. No, sorry, I will first share a small video from the Safe Delivery app in Ethiopia that summarizes key features, and then I will hand over to Hiwot. Sorry about that. Thank you for your patience. I'm now passing the presenting right to Hiwot Wupshet from the Maternity Foundation, Ethiopia. Hiwot, please unmute yourself.
Thank you. Hello, good morning, everybody. I hope you already get a very brief insight about the Safe Delivery app from the short film. So before I go to the detailed presentation, I will briefly introduce you about Maternity Foundation and the Safe Delivery app, and then I'll go to the presentations. So Maternity Foundation is an international NGO established in 2005, and it is headquartered in Copenhagen, Denmark. And we have been developing and integrating scalable programs and digital solutions to empower healthcare providers and to improve quality of healthcare in Ethiopia and in other African countries and Southeast Asia as well. So the Safe Delivery app is, a free, available on the smartphone, developed by Maternity Foundation and in partnership with University of Copenhagen in southern Denmark. It mainly provides us with skill birth attendants up-to-date and evidence-based clinical guidelines on most common childbirth emergencies and complications. And as you see briefly from the film, the app contains different features. It has videos, action card, practical procedure, my learning or quizzes that users can go through different levels. For each module, they will pass from familiar to proficient and expert level, and then even they can work on certificate exam to be champion of the Safe Delivery app. It also contains drug lists where users can navigate through per each module, which includes, the indication, contraindication, the dosage in management of obstetric complications. So far, we have 12 modules on the Safe Delivery app, recently also including a COVID-19 module as a 13th module temporarily. And then all the modules are mainly focusing on the basic BMOC signal functions or basic emergency obstetric and newborn care. In addition to that, it also includes cross-cutting issues like modules on infection prevention, newborn management, on how to manage low birth weight, active management of third stage of labor, as well as a module on female genital mutilation, especially for those countries in Africa where FGM is an issue. And recently also we developed a module for COVID, and then healthcare providers can go through the app and see the videos, action card, practical procedure, and will get enough information how to protect themselves as well as treat and protect a spread of infection and for a mother and newborn who is suspected or conflicted with COVID. So far, at the global level, we have the English version and the French version, and the Arabic version is also on pipeline. And in addition to the global versions, we have also adapted into more than 11 country versions. And then when it's adapted into country versions, it is based on each country's national guideline, and in most of the countries also based on local language. And in some of the countries, like in Ethiopia and India, we have even the app in more than one language version. So, in a nutshell, the Safe Delivery app is developed based on primarily the WHO guideline, and then a team of experts will go through each module before we share for users, and then make also sure it is adapted and contextualized as per each country guideline before we have, the country versions. And then, as I mentioned, it's mainly based on basic emergency obstetric and newborn care signal functions, and then it's really very simple, and then it's adjusted toward the low literacy level, and healthcare providers can easily navigate through each of the features and get the information that they would like to have. And once it is downloaded, it doesn't require internet connection, so users can use anytime from their smartphone. And sometimes, when we provide also trainings in the remote sites where internet connection is a challenge, we just download it through APK link, which doesn't require internet whenever we share with other users or trainees. So we share them either through Bluetooth, Zender, and the like. And then for anyone to download, it's freely available either in App Store or Google Play. And then it's also, overcome traditional barriers, especially at this time when people can't gather together to have a training. It really helps to promote remote trainings as well. And in addition, it's also easily adaptable to various settings. And then whenever there is an update in the guideline, and when it's updated, users can easily get a pop message from their mobile, so they can go click and update and get the updated version. So far, globally, we are working with more than 20 implementing partners, including UN agencies, international NGOs, and local NGOs, and mainly governments with ministries. And we are reaching more than 14 countries with these implementing partners, especially in Africa and Southeast Asia. And recently, we have more than 135,000 downloads of the app, and nearly half, or 47% of the users, are highly engaged, and most of them are actually healthcare providers. And then still, we are making adaptations to other countries whenever there is a need from countries when they request to have adapted version of in their own country guideline in local language. And we also monitor, evaluate, and share our best practices, how we have been scaling, and then we have also research projects we publish and share findings. So at national level, recently we are working in 6 countries, including Ethiopia, India, Ghana, Myanmar, Laos, and Bangladesh. And the app gets the buy-in from Ministry of Health, and it is national scale and being used by health care providers. Apart from national scale up, we are also working at the project level with various countries in Africa and Southeast Asia with different implementing partners. As, as Benedict mentioned, Mr. Zaneva would like to join us today, but due to prior assignments from the ministry related with COVID, I will make his presentation on behalf of Ministry of Health. So Maternity Foundation actually introduced the Safe Delivery App to Ministry of Health in early 2013 and 14, where we have been, having a randomized control trial study in Oromia region in Ethiopia. And we had, experimental and control group, and 2 of the modules were tested during that time on newborn resuscitation and postpartum hemorrhage. And then on the level of, knowledge, skill, and competence level of the healthcare providers were tested at the baseline at 6 months, 12 months, and 18 months within the 2 years research project period. And it was really interesting to see that the knowledge, confidence, and skill level of the healthcare providers who were at the experimental group have shown great progress as compared to the control group. And even it was really interesting to see a high level of skill retention, even as compared to the knowledge for those health providers who were in the experimental group. So taking this, as a lesson, Maternity Foundation developed the full package containing 10 to 12 modules of the Safe Delivery app. And then we have been, testing in various trainings and using the app as a job aid in different remote health facilities. For example, we have been using it in National BMOC, or Basic Emergency Obstetric and Newborn Care Training Package, whereby it's a 3 week training, which is very resource intensive. And when we were, using as additional tool in the training process, we have been able to minimize more than 200 slides from the training package, which can be easily summarized either through the videos or referring action card, through discussion, brainstorming session, group work, and the like. So in the meantime, Ministry of Health was on the process of revising their national BMO curriculum. As we sit also in the technical working group with Ministry of Health, we share our experience, how we have been using the app as an additional tool during the training and as a job aid. So we sit with a team of experts, and Maternity Foundation share its experience on how we are able to integrate in the national curriculum. So based on this, it was possible even to minimize the package, the duration of the training from 3 weeks into 2 weeks. And during piloting, even the healthcare providers, the trainees and the trainers even found up the Safe Delivery app as a good tool, even which make the training more interactive as well as saves the time of the trainees as well as the trainers. And once it is integrated into the national curriculum, the next step was to provide TOT training for master trainers in the country. And then with the help of the team of experts, Maternity Foundation taking the lead, we developed a TOT package as a team and in collaboration with Ministry of Health. And we provided TOT training for nearly 100 master trainers in the country. And following that, this national curriculum was shared at the country level, and every implementing partner in the country, whenever they do have a plan to do BMOC training with the revised curriculum, they use those trained trainers in order to cascade and scale the training. So this is just one example how we pilot and then scale the use of the delivery app in national training. The other example is a catchment-based mentorship, and Ministry of Health recently developed a national catchment-based mentorship guideline and manuals, which also integrates the Safe Delivery app. So based on the experience that we had on BMOC, it was easy to integrate on the catchment-based mentorship. And on top of that, the Maternity Foundation also developed a simulation exercise or drills, which are based on case scenarios on the specific modules which are available on the Safe Delivery app. So during mentorship, especially when the senior midwives from the hospital go and coach their colleagues in the health centers, if they couldn't find cases or clients at the facility, using the simulation drills in line with the Safe Delivery app really promotes to improve the skill and the competency of the healthcare providers. And it was not difficult, honestly, to get the buy-in from the Ministry of Health because having all these initiatives in using digital health tools was in line with the national roadmaps and transformation plan, whereby using digital tools is also stated as one mechanism to improve quality of service in the country. So far, our journey in Ethiopia looks like we started from the randomized control trial study, and then we have been, using it with partners as a job aid and as, additional to trainings, and we integrated into a national BMO curriculum in 2018, and in 2018 and 19, also it became part of the national catchment-based mentorship guideline, and then 2020 and onwards, there are, interventions on the pipeline. We are on the process of, integrating in the pre-service for the Midwifery Health Science College and University curriculum, and other modular-based low-dose, high-frequency approach and trainings like helping babies survive and helping mothers survive modules, as well as there are also initiatives and prior discussions with different association and other partners, how we can make it part of continuous professional development and how we can use the app in order to develop courses and provide for health providers. So in Ethiopia, we have been using the app in various modalities. We're using the pre-service and in service as well as a job aid. Healthcare providers, once they are introduced with the app and once they have in their smartphone, they can easily refer while they are at the job. And especially in the remote sites, if they don't find somebody to consult, like a senior health professional, they can still get a guidance from the Safe Delivery app. Just to share you our experiences, how we have been using the app in different modalities. We had a project, a humanitarian project in Gambela region in the refugee campus, where we used the Safe Delivery app as part of, BMOC training as well as on-site mentorship. And the healthcare providers, when they are introduced about the app and they start to use it on a daily basis, they witness that it really helps to promote their knowledge and skill, and even it makes life easier for them to refer, which also minimizes the need for refresher training. Again, the same is true for, when we are introducing any training like a BMOC, Especially the trainers, primarily they were afraid that it may take time to introduce the app to the trainees, and then it may require additional time, to make it part of the training. But once it is, piloted, and when they became part of the training, they really understand how it really makes the training more interactive, as well as even able to minimize time and energy. And in the pre-service in the universities and health science college, the safe delivery app is also introduced for the students as well as the instructors. And then especially they use it in a demonstration or simulation room when they are on practice. So even sometimes in the absence of instructors, healthcare workers, the students can easily use the app and then play the video again and again until they master a specific procedure. So it really helps them to improve their confidence and prepare them before they go to the actual practice in the facility. Just to share you what we have been doing in the pre-service in the midwifery health science college and universities. 2 years ago, we selected around 18 teaching institutions, and then we introduced them with the app, and we conducted a workshop with them, and they sit in a group and discuss how they can really use the safe delivery app as an additional tool to promote the teaching learning process. And we further, piloted and follow in 5 teaching institutions, and then instructors shared all the experience they have to their students, and then students, they are informed, and they download the app and they use it from second year to fourth year onwards. And even for the graduating class midwives, they start to use the simulation drills or exercises to prepare for the external exam. And then depending on which year they are and which level of topics they are, they select modules and exercise also on the My Learning, which will really, promote them to learn a lot and, improve their knowledge. And then if they forgot something, they further refer back to the safe delivery app videos, or they further read their book. Um, just also to share you our experience, how we have been using it in the catchment-based mentorship. We have a project with UNFPA in Somali region, and we have been using the safe delivery app and in the simulation during in line with the available catchment-based mentorship program. So we train the mentors from the hospitals, and they will go and mentor the mentees in the health centers. So we work in 2 hospitals and 8 health centers, and we provide them with a tablet for each health center, and then the app is also available in Somali version, so they can choose which version to download, either the Somali version or the English, depending on their preference. And especially some of the sites, the health centers are very remote, and whenever there is no client, they exercise through the simulation drills or the cases in collaboration with the mentors and assisted by the safe delivery app. And then this really helps to improve their competence and the skill through time. We also, monitor and evaluate the outcome of the safe delivery app, or the contribution it brings us towards improving, competency of the healthcare providers in terms of their knowledge, confidence, and skill. So we conducted a baseline before we start the project, and 28 midwives from the 8 facilities were part of the baseline. And during the baseline, we conducted a knowledge, confidence, and skill test. We selected 9 clinical procedures using the simulation drills. And then at the in 6 months of the project, at the end also, we repeated the same test, so that we can see the outcome or the progress. So based on the findings, when we see the knowledge level, an average knowledge increase of 42% was observed. As you can see in the graph, the blue line is the end line, whereby the knowledge level of healthcare providers is almost improved in all of the basic in management of this emergency complications. Again, the same is true for their skill level. So an average skill increase of 21% was observed as compared to the baseline. Again, from the self-reported confidence, from the two zones of the project side, almost their confidence level is increased in managing all obstetric complications. Just to share you some reflections from the midwives who have been part of this mentorship program. For example, one of the midwife was witnessing that she's a fresh graduate and she doesn't have all the competencies or experience to manage obstetric complications. And when she's part of this catchment-based mentorship assisted with the simulation drills, really helped her to transform her knowledge and skill. And then she's happy about, being part of this program. Midwife was also mentioning that, having app is an additional tool, even if there are mentors to mentor, which they will stay only for a week. And the other time when the mentor is not with her, she can even refer back to the Safe Delivery app, see the videos or any information that she needs. So all in all, this is how we have been, piloting and scaling and using the Safe Delivery app in Ethiopia in various modalities. Thank you for your attention, and I will hand over to Maurice from WHO.
Thank you very much, Hiwat, for this very comprehensive presentation, including how the app is practically used in facilities and in pre-training, but also how it became part of the national curriculum and it's supported by catchment-based mentorship and training of trainers to make it, to spread it. I'm sure you will have questions on how you measure knowledge versus skills versus confidence, which are very interesting measurements. I'm handing over to Maurice Bukagu, who will briefly talk about what it means at the moment to maintain quality service, quality maternal service during COVID-19. Maurice, can you share your screen?
Yeah, my screen is, can you see my screen?
No.
No.
Can you use the sharing
Yeah.
one again?
Yeah.
And yeah, it's coming now. And just make it full screen. Perfect. Thank you.
Is that okay? This is a full screen.
Thank you. Yes, it's fine.
So, colleagues, my name is Maurice Buchagu. I'm an obstetrician gynecologist working in WHO Department of Maternal, Newborn, Child, Adolescent Health and Aging in Geneva. And I'm happy to present on behalf of the department. I also want to thank the Global Quality of Care Network and the team from Ethiopia to give us opportunity to share some of the global guidance in this specific context of COVID pandemic. This is a very difficult situation where the entire world has been experiencing disruption of essential services, including maternal, newborn, and child health services. And we thought this would be a great opportunity to actually highlight the guidance on maternal and newborn health in this context. So, be it before, during, and after childbirth, all women should have the right to high quality of care, including antenatal care, as we know, intrapartum care, newborn care, and postnatal care, as well as mental health. And this is a very special time where mental health really matters. All women have the right to a safe and positive childbirth experience, whether or not they have confirmed COVID-19 infection. So respect and dignity, companion of choice, clear communication as stated in the standard, and relief strategies. This is something that need to be maintained even in the context of COVID. The other major element for the newborn is the close contact and early exclusive breastfeeding that should help the baby survive. A woman with COVID-19 should be supported breastfeed safely, hold her newborn skin to skin, and share a room with her baby. So these are, guidelines or recommendations that need to be maintained even in the context of COVID-19, whether women are suspected, probable, or confirmed COVID-19 with COVID-19 infection. There are a few specific elements that I want to also highlight. That is for C-section. C-section should only be formed when medically justified. So COVID-19 infection should not be at all an indication for C-section. Mothers and infants should be enabled to remain together and practice skin-to-skin contact, kangaroo mother care, roaming in throughout the day and night. And if the newborn is admitted in the neonatal unit, mothers should still be supported to express milk, have access to the unit, and participate in the care of the baby. Now, this is a new disease. It's a new viral infection. And from the knowledge that is coming up, some people might be asymptomatic and still transmit the disease. So that's why WHO is also encouraging services to really apply appropriate infection prevention and control measures, especially in contexts with high prevalence of COVID-19. So that's all I wanted to share with you. I only had 5 minutes, and I want to thank all health workers caring for people at the front line and those that are in the background to support them. Thank you. Over to you.
Thank you very much, Maurice. We now have 20 minutes or so, a little over 20 minutes for question and answer. Please type your question in the chat box. We got a few already, which I'm going to read out for the speakers to answer. The first few questions are for Hiwot. So one question for you, Hiwot, is whether the app can be used as a form of e-mentoring. And this is a question from Sheena Curry, and she asked this in case you, in the context of facility-based mentorship, when you have no actual cases to share, can you actually use the app to be used virtually? You are on mute, Hiwot?
Yes, can I reply?
Yes, please go ahead.
Thank you. I think the question is whether we can use the app.
whether you can use it as an e-mentoring tool.
Exactly.
In
Yes, as I mentioned, we have My Learning, which is one feature of the Safe Delivery app, which has, questions at each level. For each module, it has 3 levels, like they will face with, they will face the
What, we can't hear you. We can't hear you very well. Can you come closer to the mic?
Okay.
There is a noise in the background. Oh, wait. Go ahead.
Yeah. So the app has My Learning or a quiz feature that we can use as a follow-up mechanism during a mentorship. The users will first register their name and email address, so they keep on exercising the questions. In the My Learning, the questions has 3 levels, which they will start with familiar phase, like very simple questions, followed by proficiency level with additional questions. If they also pass that per each module, they can go to the expert level. And through the dashboard and the system that we have, we can trace how many of health professionals are going from which level to the other per each module. So based on the need, it's possible also to make My Learning as part of a monitoring tool and assist the actual on-site mentorship through e-mentoring, which is possible to use the app. Then it's possible to know how many of the users are really using the app, whether it's the video or the action card, how frequently they are using it, and then how far they are go in terms of using the app. And exercising through the My Learning will also give them the chance, if they didn't answer the question, it directly links to the specific video that they have to refer. So it also promotes, the learning process by themselves, so they can even monitor themselves.
Thank you. Another question for you, Hiwot, about updating the app. So Tori Oliver wants to know if you have a mechanism to update the app when there are clinical practice guideline updates from either WHO or the Ministry of Health. How do you update the app, and who is responsible for that?
Yeah. Recently, for the global version, whenever there are updates, depending on the need, the global versions like the English and the French will be updated. And then, based on the discussion that in the agreement we have with each country, whenever we make it, a national scale up, it's possible to, make it the updated version. And then whenever there are updates, even they will get a pop message which they can easily update from their phone. So it depends on what kind of partnership we have when it comes to each country level. But for the global versions, whenever there are definitely updates, we keep on updating the app.
Thank you. You also have a question from Ari Odendal, who asked if you can send the citation of the RCT publications, but I'm sure we can do that as part of the communication after this call. A question for Maurice Bouchagou from Alimene Shreta, asking if the WHO recommendation about the setup and the arrangement of caring for the woman in labor, if she suspect or confirm of COVID-19. Do you have anything to share about this? And you talk a little bit about it in your slide, Maurice, already.
Yes, I think the main issue here is the transmission of COVID infection to the service providers in case the woman is infected, and if this is known beforehand, obviously the PPE equipment, personal protection equipment, has to be applied, used by everyone, in the room. There is no specific other measure to consider for the delivery. It's a normal delivery. It could be a C-section, but the main point here is to make sure the providers are not infected, And in some places where prevalence is high, this is a recommendation for women to get tested before they actually come to delivery room. Thanks. Over to you.
Thank you. Please keep typing your question. We're reading them in the order that they appear. I have another question for Hiwot from Emmanuel Autolorin, asking what additional measure you are taking to improve the levels of performance of the health worker, because you showed in the data that you shared in your presentation that even though the knowledge and skills of trainees increased, the post-training levels were still much below 80%. So what else are you doing to improve these levels?
Yes, just what measures that are we taking to improve their skill level, right? That's the question.
The levels of performance of the trainees, yes.
Yes. It means in the training or in the actual mentorship that we have at the ground in the health facilities?
I assume in the trainings.
So, in the training, apart from using the app as part of the training, usually, for example, if it's like a BMOC training, there is a pre-test before they start the training, and then there will be a mid-course to see how their level of knowledge is improved. And then on top of that, also, like the training has a simulation exercise that they will be tested before they go to the facility. And then at the third phase, they have to also practice in the facility. If, for example, if it's a BMOC training. So through this, before they finish the training, they have to be competent enough and score 100 for the skill. This is, the curriculum, the package for BMOC training. So apart from using the app, we use like follow-ups, skill attachments, and checking their performance on actual client. Otherwise, if they couldn't find client, they will do on the simulation at the classroom. So we use these modalities to see the improvement. And then after training, if the project has a monitoring and evaluation or a supportive on-site mentorship, this also gives a chance for a one-to-one, a face-to-face on-site based coaching and mentorship.
Okay, thank you. I have a question, if that is okay. You mentioned at some point that you asked the trainee to self-assess their level of knowledge and skill and confidence. So how did you do this, and how do you make sure that you have measures that you are comparable from the starting point to the end point and across different facilities?
Yes, for the confidence, there is a measure from like 0 to 5, or from panic or completely confident. So either in the phone or in a paper, they will be asked how confident they are in managing like PPH or newborn cessation. So for each module, so they will answer the question, even it's available in the smartphone, in the app, before they start using the app. So the system by in the middle, or when they frequently use the app, will ask the same questions, and then they will reply. So based on that, we analyze how they are confident through time when they use the app. And for knowledge and skill, we use like a selected questions based on the modules will be developed, and then either we administer through paper, but most of the time through their phone. They will give a specific code, and they can do it through Kobo Collect that we can even easily get online. And then for the skill test, we have developed this simulation drills or exercises that they will be tested at baseline, and then if you have a follow-up, and then at the end line, how they are really, practicing on the doors with the case scenarios that they will be asked to practice.
Thank you. I have one other question about the new model on COVID-19, which I understand is pretty new. It's 2 or 3 weeks in implementation now. Did you have any feedback on how people use it, how useful it is, and if it makes any difference in the way they are able to deliver care now?
Yes, it's very early to measure, honestly. And first, we have it on the global version, in the English version, and now we adapted to the Ethiopian English version. And still, they are in the process of using it, so it's very recent. So we didn't get enough information about this yet. We'll let you know once we have.
Thank you. Thank you very much.
Benedict,
yeah.
can I just say something about this?
Please.
Yes, I really think this is a great opportunity for countries that are in the context of COVID-19 and with confinement in many settings, having a tool that could help the providers to know more about the new guidance or the updates or any materials that would help them improve their practice without traveling. I think this is a great advancement of the knowledge sharing and quality of care improvement. Thanks. Over to you.
Thank you. And that was another question actually as a follow-up. Not just the extra model and the content on tips and video for birth attendant to address COVID-19 context, but also after this crisis or as it continues unfolding. Are you going to continue using the app as a remote tool that you can keep? What I mean is, in the particular context of infection prevention, for example, are you going to build on this, the fact that you have an e-tool, an M tool that people can use remotely to have content in a safe way? Because that was not the point of the app originally, but in the current context, it's a completely new perspective for it. So do you see a way to build on this in the way of providing content, remote training, remote coaching in a safe way?
Yes, I can say, because we are also, starting to have this remote-based trainings on COVID, and even other modules like helping babies survive, helping mothers survive modules. We are collaborating with partners, and definitely we are, designing how we can use the app and initiate remote trainings. And this will be definitely helpful, to cascade trainings at this moment.
Thank you. We have another question from Alemina Shreta to Iwat, asking, when the app is downloaded, it works offline, but what happens when there's an update? Does it update automatically, or do you need to re-upload the app every time? Which is obviously an important question when internet connection is unreliable.
Yes, it may vary for those users who directly download from the website. Whenever there is an update, it will send like a message, and then would you like to update? There is an updated version of the app, and then if you click yes, it will automatically update. Otherwise, if it is like shared through APK link, where users in the remote area may not have access to internet, the message will definitely arrive, but whenever you are sure that you have a strong internet connection, you can click OK, and then it will update by itself.
And a question which I think it might be more for Maurice, I am not sure, from Maja Akwasus, about whether there is any new guidance on the use of corticoids for lung maturation. I'm not sure, Maurice, that you have an answer on the top of your head to that, but let us know.
Not for now, but it will soon come. There is a guidance on the use of corticosteroids for preterm. The new guidance is almost ready and should be made available to the public.
Thank you. And as a follow-up to that question, to Majda, all these guidance are available on the WHO website. If you go, there's a whole page on COVID-19 guidance, and then per different topic as well. So I think if I have no more questions, we have no more questions from the participants today, in which case I'm going to wrap up. Thank our two speakers today. Thank you, Iwat Rupshet and Maurice Buchagu, for your input and for providing some context into the use of this app. Thank you also for presenting the slide on behalf of Zenebe Akali, who could not make it today. We will be sending you the recording of this session as well as the presentation tomorrow, and they will also be available on the Quality of Care Network website. We will have a second session on the use of the Safe Delivery app in India very soon in the weeks and months to come, and we'll inform you about this as well on our website. Thank you very much for your time and for your question today, and thank you for our speakers. Bye bye.
Thank you all.